Alright. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. All praise to Allah Subhanahu wa Ta'ala, the Lord of the world, and welcome to this general lecture. It gives me great pleasure to be here as Master of Ceremony, and I'm so excited to host it. Honorable Dean of Faculty of Medicine, Universitas Andalas, Honorable Dean of Faculty of Dentistry, Universitas Andalas, Honorable our keynote speaker, Profesor Ikuo Kageyama DDS PhD from the Department of Anatomy, the Nippon Dental University School of Life Dentistry, Niigata, Japan. Welcome, Prof, to the Faculty of Medicine, Universitas Andalas, Padang, West Sumatra, Indonesia. I hope, terima kasih. Honorable Vice Dean of Faculty of Medicine, Universitas Andalas, Manager of Faculty of Medicine, Universitas Andalas, Head of Department of the Faculty of Medicine, Universitas Andalas, Professor, Lecturer of the Faculty of Medicine, Universitas Andalas, Education Staff of the Faculty of Medicine, Universitas Andalas, Student all of Study Program on the Faculty of Medicine, Universitas Andalas, and to all the audience. All right, ladies and gentlemen, welcome to the general lecture entitled New Paradigm in Anatomy Education by Professor Ikuo Kageyama from the Nippon Dental University School of Life Dentistry, Niigata, Japan. Let's give a big round of applause. All right, thank you. All right, ladies and gentlemen, singing national anthem, Indonesia Raya. Audience aids please to stand. Audience at a place to sit. Prayer by Yogi Gunawan. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Izinkan saya pada hari ini membacakan doa penutup yang akan dipimpin secara Islami. Bagi yang non-Muslim harap menyesuaikan. Bismillahirrahmanirrahim. Ya Allah, Tuhan yang Maha Pengasih lagi Maha Penyayang. Segala puji dan syukur kami panjatkan kehadirat-Mu atas segala limpahan rahmat, karunia, dan hidayah-Mu, hingga acara kuliah umum yang kami selenggarakan hari ini dapat berjalan dengan lancar dan penuh manfaat. Ya Allah, jadikanlah ilmu yang kami peroleh hari ini sebagai ilmu yang bermanfaat, yang dapat kami amalkan demi kebaikan umat dan kemajuan dunia kedokteran. Berikanlah kami kekuatan untuk terus belajar, berkembang, dan berkontribusi dengan keikhlasan hati. Ya Allah, berkahilah para narasumber, dosen, dan seluruh peserta yang hadir. Limpahkanlah rahmat dan petunjuk-Mu kepada kami semua, agar senantiasa berada di jalan-Mu. Ampunilah segala kekilafan dan kekurangan kami selama penyelenggaraan acara ini. Satukanlah hati dan langkah kami dalam kebaikan. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Subhanaka Allahumma wa bihamdika asyhadu asyhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Wassalamualaikum warahmatullahi wabarakatuh.
All right, ladies and gentlemen, we move to the next agenda. Speech from the chairman of the committee, general lecturer, Dr. Tuti Lestari, SPB. Peanuts from Department of Anatomy. Please welcome Dr. Tuti. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Puji dan syukur kita panjatkan kehadirat Allah Subhanahu wa Ta'ala karena rahmat dan karunia-Nya kita semua berada di ruangan ini dalam keadaan sehat walafiat untuk mengikuti acara ini. Kemudian selawat beriring salam kita kirimkan ke manusia paling mulia di muka bumi ini, Rasulullah Nabi Muhammad Sallallahu Alaihi Wasallam. Allahumma sholli ala Muhammad wa ala ali Muhammad. Allow me, as the head of the event committee, to express my gratitude for you all present here. Our Honorable Dean, Faculty of Medicine, University of Andalas, Honorable Dean of Faculty of Dentistry, Universitas Andalas, Honorable our keynote speaker, Profesor Ikuo Kageyama, DDS, PhD. Welcome again in Andalas University. Honorable Vice Dean of the Faculty of Medicine, Manager of the Faculty of Medicine, Head of Department of the Faculty of Medicine, Head of Undergraduate, Postgraduate, Professor, Specialist, and Subspecialist Study Program in Faculty of Medicine, Professor, Lecturer of the Faculty of Medicine, Educational Staff of Faculty of Medicine, and of course, my dear student all here that can gather with us in this lovely room. On behalf of the organizing committee, it is my great honor and pleasure to welcome all of you to today's public lecture titled New Paradigm in Anatomical Education. This event marks an important step in our ongoing effort to enrich the academic environmental and encourage innovative thinking within the field of anatomical education and science. As we know all, anatomy has long been a cornerstone of medical and health science education. However, with the rapid advancement of technology, evolving pedagogical approach, and the shifting demands of the modern healthcare, the way we teach and the way we learn anatomy must also evolve. Today's lecture aims to explore these emerging trends and discuss how we, as education and learner, can adopt the more dynamic and effective model of anatomical education. We are grateful to have with us an esteemed speaker who brings valuable insight and experience to this topic. We believe that today's discussion will inspire the ideas and collaboration, and most importantly, ignite a deeper passion for the science of the human body. We would like to thank all and to thank everyone who contributed making this event possible, especially to Prof. Nila for bringing the Prof equal to Faculty of Medicine. Thank you, Prof. And then let us use this opportunity to learn and engage and think forward. Thank you, everyone, and please welcome and enjoy this lecture. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you, Dr. Tuti. Next session, opening and welcoming remark of general lecture from Vice Dean of Faculty of Medicine, Universitas Andalas. Please welcome Dr. Rosa Sukmarita, PhD. Time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, praise to the God that we can meet together here in this room. Maybe I would like to welcome to Dean of Faculty of Dentistry, Universitas Andalas, and then our manager, Dr. Citra, Dr. Vika, and then also the head, the chief committee of this general lecture, and head of department anatomy, Dr. Afdal, and then professor lecturer of Faculty of Medicine, Andalas University, and then all the students from undergraduate, postgraduates, and also profession specialists. Maybe this morning I saw some from orthopedic specialist program. And of course, our special keynote speaker, Professor Iko Kagema. Thank you very much, Sensei, that you can come to Padang. And also I want to say special thanks to our Dean of Faculty Dentistry, Prof. Nila Kasuma, because we have communication that Faculty of Medicine have a chance also to have a very great professor, Professor Kageyama Sensei, that also best friend of my professor, Takashi Yashiro. So it's been a very happy for me to meet him here. Thank you very much, Professor. And I would like also to say thank you to all the committee that have do preparation to this general lecture. Our Dean, Dr. Supri Rahman, have apologized that cannot come here on time because there is a ceremony of educational day on Lima Manis campus, and asked me to continue for the opening remark this general lecture. So maybe this time I will open the general lecture, start from now on. Okay, thank you very much, and please we enjoy the lecture from Professor Kageyama. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you to Dr. Rosa. Next, we have a photo session. Please, to Dr. Rosa, Prof. Iku Kageyama, to stand in the front. And yes. And we invite you, the Dean of Faculty of Dentistry, Manager. Okay, formal style first. Look at camera. 1, 2, 3. Right. Okay, we invite you to moderator and head of department, Pak Afdal and moderator to enjoy the. Oke, selanjutnya kita foto bersama audiens. Bapak Ibu mohon izin, mungkin kita bisa mengarah ke audiens dan mohon izin kepada seluruh peserta untuk dapat berdiri. Kita akan melakukan foto bersama terlebih dahulu. Alright. Wait. Okay, ladies and gentlemen, now we move to the main session to a general lecture by Professor Ikuo Kageyama. This session will be guided by Dr. Dewi Rusnita, MSc PhD, from Department of Anatomy, Faculty of Medicine, Universitas Andalas. Please welcome Dr. Dewi Rusnita, MSc PhD.
Tes, tes. Ya. Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. My name is Dewi Rusnita, and I'm honored to be your moderator for today's session with the title New Paradigm in Anatomical Education. So I'm currently a member staff of Anatomy Department, and I've been involved in teaching anatomy for several years. Thank you to all attendees for taking the time to join us this morning. It's a pleasure to be here with all of you, respected colleagues, my students, residents, and subspecialists. I'll be guiding our discussion and making sure that the program runs smoothly and helping facilitate question and interaction after the presentation. Before we started, I would like to introduce our distinct speaker today, Professor Dr. Ikuo Kageyama, GDS PhD. He's a leading expert in anatomy with an impressive academic and international career. He currently serves as a professor and chair of the Department of Anatomy at the Nippon Dental University in Nagata, Japan. Dr. Kageyama began his academic journey at the Nippon Dental University in 1977 and obtained his dental degree in 1982. He earned his PhD from the GK University School of Medicine and has held esteemed position and visiting professorship in Germany, Canada, Australia, and Sri Lanka. His research interests include clinical anatomy of the head and neck, dental anthropology, and anatomical education. He's a member of several respected professional organizations, including the Japanese Association of Anatomists and the American Association of Clinical Anatomists. His publication reflects a deep commitment to advancing anatomical science. Without further ado, please join me in welcoming Professor Dr. Ikuo Kageyama. So the floor is yours, Professor. You will have up to 1 hour for your presentation. Time is yours.
Can I start now? Okay.
Sensei.
Hi, good morning. Good morning, everyone.
Good morning.
Good morning, everyone. Dear distinguished guest and the professor, and thank you for my introduction, Professor Debbie Rusnita. Okay. Dr. Debbie Rusnita. And thank you for inviting me. First thing, Professor Lauza, sorry, not the correct pronunciation. Sakna Rita, and thank you for the invitation, Professor, to Reston, Professor to Reston, okay? Chief Committee General Lecturer. Yeah, thank you. And also, Professor and the Dean of Professor Nira Kasma, thank you for inviting me. And okay, on behalf of all staff of the Nippon University, I'm very happy and thank you for your attendance at my lecture. And then first of all, I want to ask you the question, maybe you're not students anymore and you graduate from dentistry, maybe raise your hand. And medicine, raise your hand. And your specialty is TMJ, otolaryngologist, isn't it? Or plastic surgeon, any this kind of, or orthopedics, or any surgeon, maybe, yes. Okay, anyhow, I'm very pleased to be here to give my short presentation about possible this neck, okay, artery, we call it the maxillofacial artery, maxillary artery. And then, okay, so it's maybe interesting for you to listen to the lecture about implantology from dental fields. And then third, I'm going to tell you about joint lecture between anatomy and physiology. It is good for you, maybe, ladies and gentlemen, and okay, residents from Andalas University. Thank you. Thank you for your attendance. First of all, let's start. Okay, this is maxillary artery, as you know. Maxillary artery, okay, is a branch of the external carotid artery. As you know, external carotid artery, okay, the common carotid artery divided into two pools at the level of hyoid bone. Here, this is a hyoid bone, as you know. And to the external carotid artery and the internal carotid artery. Yeah, and then maybe when you're a student, you're wrong, or you have lots of knowledge about maxillary artery. Maxillary artery is branch, one of the branch of the external carotid artery, and also maxillary artery has three branches, okay? This is the first part, second part, third part. It's totally fine, easy. First part is, we call it sometimes mandible port, because it's part of the mandibular limbs. Do you know limbs is corpse? Limbs, mandible consists of two parts, limbs and corpse, body of mandible. And then second part is as you know, as a masticatory muscle, we have four masticated muscles: masseter, temporalis, lateral, and medial pterygoid muscles. And then these port, we call, that's why, pterygoid ports. And third, and we call paratopterygoid, okay, sorry, pterygoparatine pine, here, pterygoparatine part is the last part of the maxillary artery. Okay, let's move here. And now, today, I'm going to speak about, okay, first of all, the posterior superior artery, and then infra of the artery, a greater parting artery, and so on. And okay, in Japan, we are lucky. We have a good donation system. As I told you yesterday, in Japan, we have 29 dental schools. And how many medical schools? Maybe you know. She went to one of the good, prestigious, almost #1 medical school in Japan, Jati. Professor Yashiro. Yashiro was professor at the Jati University, Medical University. We have 82 medical schools and 29 dental schools in Japan. And then medical school, dental schools, we have enough cadavers. For example, in my university, we have now 100 cadaver stock, and 500 applicants. It means those who want to be cadaver in the future, not now. Okay, if they die, we donate to medical and dental university for the medical and dental students. Yeah, that's why each year we can dissect cadavers. That's okay. Thanks to such kind of law. We also have a cadavers law. Cadavers law was implemented back in 1957. And then, first of all, in Tokyo University is one of the best universities in Japan. They have no cadavers, but year by year, the number of cadavers is increasing. And now at the moment, Tokyo University, maybe 3,000 more, maybe. And they have to refuse. Because why? After this. And I want to be cadaver of Tokyo University. And because Tokyo University is the #1 university in Japan. That's why. But they cannot struggle. Because they cannot operate. They cannot, not operate. They cannot dissect cadaver. So for a short period. So as you know, the dissection period. And how many cadavers do you dissect per year? Yeah, maybe 4, 5, or 3, 2, 1. Now in Japan, 30. Okay, each university, 30 cadavers. For my dental schools, each year 60 students. That's why we need only 15 cadavers. 15. And how about medical school, like a GK University School of Medicine that I work for, 120 students, and that's why they need 30 or 40 cadavers, 40 cadavers for each year. And then after we dissect cadaver, okay, we cut it out. And bring the cadaver to the cremation office and burn the cadaver to make ash and return the relatives. And all relatives, they're happy because they're returning the ash burning remains. That's why each year we have new cadavers. The student can dissect the new specimen, new cadavers. That's why so I think this Japanese system is so good. Maybe it's in the future, if maybe you have a chance, maybe I want to introduce to it's maybe the Indonesian government. And how many medical schools in Indonesia? Maybe quite a few. 50? 100? 100, so many. Oh. And all the medical schools, all dental schools in Indonesia, if they have enough cadavers, they're happy. Okay, don't use anatomy anymore. Oh, anatomy somehow, I don't criticize. Yes, but anatomy is anatomy. It's maybe 1 or 2. Okay, examples. However, I want to show you today, human being has different structure and different course and different, for example, origin, course, and distribution. Maybe you know these things, these difference in this lecture. Okay, let's begin. As I told you, okay, before the maxillary artery, there were 3 parts. Here and here and here. This is our left side. Yes, left side. I dissect this cadaver by myself. And after dissection, we have to draw, sketch. And we make them, students, draw like this. Students also, okay, I don't want to draw. Okay, it's just a hard time. It takes a long time. However, after they complete drawing of the some kind of sketches, they are so happy, so happy. And then we're talking about sphenopalatine artery, and okay, first of all, inside the middle of the skin, and so make an incision horizontally, and peel the skin the lateral side, and then, as you know, in the head neck region, here, platysma muscle here, underneath of the skin, and underneath of the skin, and after that, platysma here, platysma muscle, and we let them lift the skin upward, and after that, you can see the sternocleidomastoid very clearly, and behind sternocleidomastoid, and cervical plexus, cervical nerves, very clearly seen. And then we let them draw something, and after that we cut the original portion of the sternocleidomastoid and the sternoclavicularis, oligoclavicular portion and the sternal portion. We cut the origin, and then after that we deflect the sternocleidomastoid to lateral side. Here, this is a sternocleidomastoid in the middle. Yeah, this is not so good. So, and then, okay, after that, after not remove, deflect sternocleidomastoid. And then after removing or deflecting of the sternocleidomastoid, it's easy to observe suprahyoid muscles, infrahyoid muscles. As you know, infrahyoid muscles consist of 4 muscles: sternohyoid, sternothyroid, omohyoid muscles. And then after that, also suprahyoid muscle is easy to see. The digastric muscle, okay, geniohyoid muscle, and sternohyoid muscle. And also here, last one is, gravicular muscle and so on. And all muscles have different nerves. And after that, we let them students to remove mandible, lower jaw. And then after removing the mandible, easy to see the infra-alveolar nerve, infra-alveolar arteries, and the lingual nerves, called the tympani, joined together to lingual artery, lingual nerve, and so deeper infrastructure, infratemporal structures. This is very important. And for students, those who want to be ENT doctors, otolaryngologists, or maxillofacial surgeon, or maybe ophthalmologist, or maybe a plastic surgeon in the future. Very important. If they don't know anatomy, they should not operate on the patients. Otherwise, so dangerous. Here, this is old anatomy book. let's move to the, subject to palatine artery is also branch of the maxillary artery. As you know, so descending palatine artery divided into two parts. First is greater palatine artery, and second is lesser palatine artery. And here, this is the old book. But, old book doesn't mention, relationship between artery and nerve. Artery and nerve doesn't mention. That's why, so only this book was written by Professor Moore, T.S. Moore, and Professor of Toronto University. He passed away just 5 or before COVID. I met several times. He's so, well, big guy like this, anatomy is so important. Yeah, I like him. And he wrote a book, Clinical Oriented Anatomy. And only this book is very precise and very good anatomy book. And also by myself, I dissect the palatine part of the human being. Of course, I cut middle. Here, this is the middle sagittal section. And I also scrape all the connective tissue, including artery and nerves, and put below, and I use a microscope, not microscope, stereo microscope is not a specific one. And I load it. And all the cases, as you can see, palatine artery is so beneath to palatine nerve. It means, first of all, superficially, you can touch palatine nerve, then palatine artery. All the case. Palatine artery is beneath, is deeper to the bone. It is very important for the surgeon. And if you cut the horizontal section, is very dangerous. But as you can see, this distribution in the course of the palatine artery nerve, very important. Before your operation. Yeah. And maybe this is the group, we found it, Bonigata. This is not for nerve, but for artery. Here, this is sometimes bony tunnel. Yeah. That's why, so summarize distribution pattern and the relationship between greater palatine artery and nerve. Okay, let's skip it. Yeah, and then it's important, another important thing is not ophthalmic artery. Yeah. Yeah. This Diana, please. Okay. Good. Because the Zoom stopped. Okay. Okay. Yeah. Okay, thank you. And next, let's move to the, some important knowledge of implant. Implant is, that's also almost all this is for very important knowledge for maxillofacial surgeon or dentist. But it is also good to know for the residents from the ENT doctors and the plastic surgeons and so on. We dissect 104 calibers, and we're lucky because, as I told you, every year we can dissect 20 calibers and 40 calibers, sometimes depend on medical or dental university, each year has fresh cadavers. And then 104 cadaver, 208 side, male 108, female 100. And age, the cadavers age range from 46 and 98. Last year I dissected cadaver aged 108 female subject. Wow, 108, but not this one. And then, okay, as I told you, maxillary artery divided 3 parts, 1 part, 2 parts, 3 parts. First part, mandibular, second part, pterygoid part, third part, and pterygopalatine part. Yeah. And if you dissect the maxillary artery, as you know, maxillary artery, okay, is a branch of the external carotid artery. The last branch of the external carotid. Maxillary artery and temporal superficial artery. So we find it using our spacemen. In the lateral side, it means here, this is the left side, right side, almost, but this is the right side, not left side included. Okay, this is left side, this is also left side. Okay, left is lateral type, right is medial type. What does it mean, lateral? What does it mean, medial? As you can see here, here is orbit, here is orbit, and here is the hole, this is the ear. That's why this is right side. You can see from the right. And LP is stand for lateral pterygoid muscle. Lateral pterygoid muscle. The red one, as you know, this is maxillary artery. Maxillary artery usually in Japanese case is goes through anteriorly, superficially to the lateral pterygoid muscle. However, in Caucasian, 60%, they deeper. It means deeper to lateral pterygoid muscles. Do you know why? Do you know the reason? No, nobody knows at the moment. But we find this is correct result. This is the result. This is the authentic result. Japanese has 90%. The cause of maxillary artery is 90% of Japanese. The cause of maxillary artery superficially go through, not through, but as a go anteriorly, so superficially to the lateral pterygoid muscle. However, Caucasian only 60%. In the case of the neck surgeon, or here, this is a mandible cancer, then you should know this percentage. Okay, if you have to operate on, I think maybe Mongolia, I haven't dissected Indonesian cadavers yet. But we have same face. That's why, so I think this same percentage between Japanese and Indonesian. Yeah. That's why, but not same percentage between Japanese and German. No. That's a big difference. And it means if you open or if you reflect mandible, is very careful to dissect or to operate on the patient, because the maxillary artery is so thick. If you cut and breathing, of course, breathing 2 meters, 3 meters, woo, you need ENT, okay, emergency, okay, emergency section. That's why, so you don't have to, be careful. Don't cut maxillary artery in the middle. Here, this is the left side. Okay, the former one is the right side. This is the left side, Okay, this is a lateral type, and this is the medial type. Okay, Japanese, okay, very 90% of Japanese, they have a lateral type. In the lateral type, MX is stands for maxillary artery. Maxillary artery has lots of branches. For example, okay, so no, negative. Don't look at the other branch. But okay, in this type, okay, today, please concentrate on IA, inferior alveolar artery. Inferior alveolar artery is here. Inferior alveolar artery to the teeth. And MM, middle median artery, to the, okay, dura mater encephalus, to the brain. Okay? To the brain. Okay, what's the first branch at the lateral type? Is MM. Middle median artery is the first branch, and IA is the second branch. Inferior alveolar artery. However, in the case medial type, oh, it's so surprised. Inferior alveolar artery is the first. IA is the first here. IA is the first branch. And middle median artery is the second branch. It's be careful. There, okay, surgeons should know this. Okay, if the patient, it's easy to know the medial type and lateral type. So use the angiography before operation, and you can find it using CT, MRI, or PET scan, and easy to find. This patient is lateral type. This patient is medial type. But if you have to operate on medial type patient, be careful. Okay? And then this is a whole frequency of the course of the MX maxillary artery, running laterally, superficially to the lateral pterygoid muscle. Wow! Very surprised. All Japanese, Adachi Buntaro is long. He passed away. Old Japanese anatomist. He worked for Kyoto University. It's one of the prestigious university in Japan. And Tsuda, I don't know him. But Adachi is very famous. And Maeda and Kageyama, we dissect the cadaver. So cadaver, the frequency of the course of the maxillary artery, which we dissected, in Japanese case, over 90%, they have a lateral type. However, occasion like Thompson, Rudy, Laska, American white, 55. Much lower frequency, which have a lateral type. Yeah, that's kind of thing is happy to know that. Yeah. And then, okay, this is, let's skip it because we talked about already, about paradigm artery. Here. Yeah, it's the same. Okay, here the same. Yeah, let's skip it. Yeah, and let's move on to this topic. Also, the posterior superior alveolar artery. Is this artery is also last branch of the maxillary artery. The red arrow is as you can see, is here the last branch from the maxillary artery. We call the posterior superior alveolar artery. Yeah. Here you can see this one, and this is exempt from my drawings. Here this is much better to see. Here the maxilla, right maxilla, and premolar first, second premolar, and first, second, third molars. And posterior superior alveolar artery is artery for molars, premolars. And how do you know this is so? dangerous. But if you have CT like this, it's easy to know that the alveolar canal, if you find alveolar canal in the maxillary bone, and it maybe has this posterior superior artery goes through the maxilla bone. And then after operation, you have to very careful about it. Yeah. Anyhow, also, if you dissect the cadaver precisely, such kind of, anomaly, maybe you may find it. This is a double case. Usually we have only one case to the inferior artery, but sometimes it's double. And like this, on the right side in the middle is to cadaver, take a picture, and after take a picture, to draw so precisely and then make such kind of good figures. Yeah. Okay, let's skip it. Yeah. And then now maybe we can speculate the formation of the maxillary artery. And if you think about formation and back to the development, embryological stage, it's also important. And comparative anatomy is also important. That's why fresh cadaver is so important to dissect for first-year students. Fresh cadaver, yeah. Fresh cadaver. The old cadaver, okay. Someone already dissected. Okay, no bad, but much better to dissect the fresh cadaver, isn't it? Yeah. And then, this is our speculation. It might be the development stage and embryological period. I think these are this is a common carotid artery divided at two parts at the level of hyoid bone, at the hyoid bone, external carotid artery is EC. The internal carotid artery is IC. EC has, I think, anatomical circle in the developing stage. And if the superficial part of the anatomical circle disappear, and in this type, the medial type, if the deeper part of anatomical circle disappear, in the case is the lateral type. Yeah. Here, such kind of thing is, this is not memorization of anatomy, this is a thinking anatomy. And if you, have anatomy, and first of all, let's dissect precisely and draw the pictures, and after that, compare with other partners, and if possible, maybe 5 is enough, possible, or 4 is enough, 3 is enough, much better. Better than 1, better than 2, better than 3. Okay, 3 is enough. And let's compare with another samples. Yeah, let's move on to the, another topic. Today's topic again, here is a joint lecture. Okay, sorry, once again. Yeah. Please help me. Joint lecture. Yeah. Yeah. Okay, please. Thank you. It's okay? Okay, now let's move on to another topic. And this is totally different. the student, okay, during the medical dental students, and after they become a physician or dentist, and even nurse students, and then what is the most difficulty? What's the most difficult subject in medical fields? They often, not always, but they often talk about anatomy is difficult and physiology is difficult. Okay, why don't you join together anatomy and physiology? Yeah. And then today, okay, it's one of the tips to join together of anatomy and physiology. And okay, now concentrating on central CNS, central nervous system. Now we have a problem, as I told you, okay, all the time it's decreasing, and then in Japan too, maybe all over the world, United States, European countries, maybe in Indonesia, the medical dental student, they have to learn loads, because new subject is coming, molecular biology, CT, MRI, PET. Oh, we have to learn more and more, but still anatomy and physiology is very important. Okay, why don't you study? Well, okay, why don't you join? Why or stick together? Okay, they have to study lots of subjects. Anatomy and physiology are fundamental. Yeah, everybody knows. Yeah. Okay, this is most important subject for medicine and dentistry. Yeah. And we tried joint lecture and practicals for anatomy and physiology on the central nervous system. Yeah. We let them 95 students of the Nippon University of Niigata. And also we use the place, the dissection room. It's easier. And we asked the professor of physiology, Dr. Sato, to join us. And from anatomical side, we have at the time 4 gross anatomists. Here, first of all, practical for CNS like this. Okay, using this is me in the left side. On the right upper is Professor Yoshimura, and on right, right below is Professor of Physiology. And then CNS, central nervous system, or the brain, brain and spinal cord. To learning brain spinal cord is the most difficult part, isn't it? Especially, the words is so complicated, and it's function also more complicated. And why don't you so stick together? First of all, we show that here. Now what a brain stem? Okay, brain stem consists of pons and the middle brain, the pons, and the middle oblongata. And everybody knows it. Okay. And here is a lot of cranial nerve nucleus. But it's too many. That's why. For example, we let the student only think about, first of all, in this case, trigeminal nerve. What is cranial nerve nucleus of the trigeminal nerve? Okay, we have maybe, from the physiological side, 4 or 5 nucleus here. Nucleus, sensor, nucleus, pain, and nucleus, and sensor and pain and the motor nucleus. And also it's one others. Yes. Yeah. Pain and sensor. And we cut it. We cut it. So this is the midbrain. And as you can see, we can see the substantia nigra and the nucleus. And also, we have such kind of specimen. And we let them draw. Drawing is so important. Yeah, this is our specimen. The pons. But so it's difficult to find which nerve in it, which nucleus. But pons, it's easy see to the pons ventricles. Ventricles is very easy because of the hole. Yeah. And then another type here, medulla oblongata. Oh, as you know, medulla oblongata has lots of function and lots of, nines, tens, 11s, 12s, nucleus inside the medulla oblongata. Also, this is, the deduction is so important. And then, so knowledge of medulla oblongata is very important for clinical field. And then, so I show the real medulla oblongata and let them draw. And then finally, we ask together and, we set 10 questions or 20 questions. What are the law? What are the function of the medulla oblongata? What are the function of the pons? What are the function of the middle brain? Oh, what do you think about, brain ventricles? What is the development, embryology? And inside the practicals, and we introduce and we asked the physiological professor and anatomical professor, they stick together and with students, this is important. And after that, we ask students several questions. Are the joint lectures and practicals of CNS useful? Yeah. And they agree with us. Maybe some of them, they don't agree. But it's okay. Did you understand the joint lecture of, what does it mean here, AP? But they understand, yeah, very well. And it's a joint, lecture, what is the lecture? Here. Yeah, practical, lecture and practical, lecture and practical. Lecture and practical is necessary, yeah, they say yes. And the word interesting in the joint lecture, practical, together, anatomy and physiology. They say yes. Regarding a method of joint lecture and practical, yeah, very good. Oh, good. Yeah. Some of them very bad. Some, always exist such kind of students. Yeah, I don't like this method. Can you recommend a joint lecture to the student for next year? Almost all. Yes. Yeah. Regarding the time of the, this is a problem. We need, it takes time. That's why maybe we have to change more. And a positive comment from student, I let them know, we understand the difference between anatomy and physiology in the CNS, central nervous system. We understand the relationship between anatomy and physiology, as well as with other medical subjects. And positive comments. We were interested in the neural conducting pathways, including the afferent and efferent pathways. And 4, we understand the relationship between basic medicine and clinical medicine. However, also, pros and cons, always. A lot of time, too long, some notice that, no, it's so boring. Always exists. Knee breaks in between lectures practice. Yeah. And sleepy. Some of them get sleep due to the darkness. Need more clear explanation for each point. Yeah. Always pros and cons. Always, positive part and negative part. Yeah. Advantage and disadvantage. Finally, let's move on conclusion discussion. Overall, the use of joint lecture and practice CNS was an efficient method for students. To sum up, joint lecture will be useful for understanding not only basic medicine, but also clinical subjects. Yeah. It's gonna be, it's somehow is such kind of trial is almost, almost always efficient for general medical students. Yeah. Okay, and then I have the running time, and then maybe if you have any question, I'm very happy to answer your questions from resident area or resident doctors. Do you have any question? Can I compare that? Continue that?
Prof, maybe you can just sit here. Yeah, yeah. Thank you very much. Please give applause for Prof presentation. It was really, really interesting and insightful presentation. He describing about the variation of the anatomical structure, which is complex, yeah, in the central nervous system, including in head and neck region. Explain about the artery maxillaris and palatine artery. So we truly appreciate your time, your expertise, and your valuable knowledge that you have shared with us today. So if anyone, so now I'm gonna open the floor for discussion session. So this is a great opportunity for you to engage further, ask questions, and explore the topics presented more deeply. So if you have any question, just raise your hand, or if you're too shy, you can, okay. If you are too shy, you can write on a piece of paper, or you can ask directly to the prof. Yeah? Dr. Tuti, you have question? Okay. Okay, thank you very much.
Assalamualaikum. Thank you for the time.
Yeah.
Good morning, Prof. I really want to know, really want to know, how long does it take you to get such a high level of skill in drawing? Because I know all the picture in your presentation earlier is made by your own.
Yes.
I really want to know. Thank you.
Yes. Because okay.
Yeah, you can answer directly.
Yeah. If so, first of all, so I want to draw dissect by myself and draw by myself, and then continue. Okay, again and again, and then I have a knowledge about the dissection also dissection method. Then I'm very happy to let students do same things, and that's why. So the university I work for, and then some university in Japan, including GK University School of Medicine, they in the Department of Anatomy, they let them students draw pictures. Yeah, but not all Japanese medical schools. Thank you for your question.
It starts when you're still a med school student, or when you already become a lecturer?
Yeah. And then, okay, some of, as you know, not all students, they don't agree. And some of them, they couldn't agree that, but some of them, they agree, totally agree. And such kind of students, they're so diligent and they want to go to postgraduate student, and then they want to go to the maxillofacial surgeon and also the medical field. Also, they want to go to, brain surgeon and thoracic surgeon or cardiac surgeon. Yeah, such kind of, so they want to be, and they want to, yeah, they want to, I think, so we can encourage them go to the clinical field, and especially using hands operation. I mean, yeah.
Can I still have a second question?
Okay, yes, yes, sure.
Prof, has been any research on the use and benefit of the lateral and medial types of maxillary artery that you already know in presentation before?
Yeah.
Any benefit for that kind of variation?
Yeah. Okay. If you know such kind of variation at the, okay, so at the surgery, at the operation, and if they have lots of knowledge, including variation and anomaly, and they have such kind of confidence, and then confidence, and also confidence is very important, and also they can teach, and the speed of operation time is decreasing. And so I told medical dental students, I had experience. I was in Germany for 2 years, and I met Professor Majid Sami. He's a super, okay, neurosurgeon, but he originated from Iran, and he immigrated into West Germany at the time, back in 1986 or more than 80. And he became Professor of Mainz of neurosurgery. And his technique is so fast. And then my supervisor at the time, another name, Professor Johannes Lang, he organized 1 week seminar or 5 days seminar for neurosurgeon, sometimes ENT, otolaryngologist, sometimes plastic surgeon, sometimes maxillofacial surgeons, and for neurosurgeons, all the time, Professor Majisami is joining. And then I can, at the time, ask, so another maxillofacial surgeon, and why he's so fast. And he told me that. He told us because he knows anatomy. Anatomy is, in German, anatomy is the wichtig. Weil ich bin here. He said anatomy is so important. And due to my knowledge, not only so general knowledge, but also he knows everything, including anomaly variation. And then he has confidence afterwards. And usually so for brain surgery, okay, it requires 20 hours or more, maybe 10 hours. But he finished 2 or 3 hours because he knows anatomy. It's good for not only for the patients, but also for the other staff. Yeah. But still, anatomy is so important for next maybe 50 years, 100 years. But later, I don't know, but maybe 50 years, in 50 years. Yeah, anatomy is so fundamental. Okay, physiology as well, but anatomy for the surgeon is so important. Without anatomy, they cannot operate on patient, or they should not operate on patient because too dangerous. Sorry for patients. My opinion.
Thank you, Prof.
Thank you. Thank you for your good question.
Yeah, Prof, this is question from my own.
Yeah.
Yeah, continuing the previous question, because you're pressing about the importance of anatomy in the medical education.
Yeah.
So, because we're talking about the new paradigm in anatomical education. So, what I understand so far about new paradigm itself, it's like a changes or shifting from the conventional method into the new method, like digital base at the moment.
Exactly,
So I'm just wondering, because you presenting your research based on dissection, because you did a lot for researching about the variation of the anatomical structure, mainly for complex region. So do you applying like a digital base in Japan? I don't know. Are you doing just purely dissection and studying using cadaver for anatomical education, or you do combination between the two of them?
Okay.
Just share your experience in Japan.
But it's
Thank
a
you.
very good question. Nowadays, and then during my short stay in Andalas University, I saw anatomy. And then, as I told you, in Japan also, and basically, okay, 82 medical schools, 29 dental schools. We let them dissect cadavers first. Cadaver, anatomy is covered. But okay, supplementary, but some of the university, they're using anatomy, but for the supplement, fast, but they have to dissect cadaver. It's it's a kind of low. Medical students and dental students, they have to dissect cadavers. That's why. So we also have, as I told you, good donation system. That's
Yeah, I
really
mean,
happy.
yeah, you are so fortunate to have that. I mean, a lot of humans that want to donor themselves for dissection later on. But I mean, it's different from our country. I mean, from cultural part, it's difficult to get that hundreds of cadaver to dissect there. I mean, it's not many people want to donor themselves for to be done. I mean, to be used by medical student. So I mean, it's also a challenge. I mean, in this country, but not sure, not sure if in the future we can try to. But not, because we have difficulty, you know, with the ethical issues. Ethical issues, cultural issues, to use cadaver. So I mean, do you have any other approach that we can apply in the setting of limit number of cadaver for study? Do you have any other approach that can we apply here? So because we are facing limitation in number of cadaver to study.
I know.
So I mean, do you have any other approach or suggestion? Maybe shall we move to digital base, for example? But I don't know, because what kind of digital base that you use in Japan? Is this like a AR, augmented reality, or virtual reality? I don't know. So maybe you can share your experience.
That's good question. Also, some of the university and then maybe not lots, but some of the university, they are using digital anatomy, using AI and anatomy as you have. However, we have a dissection law and anatomy law, and then they have to dissect cadavers once in their medical and dental students. Therefore, still also we have a good donation system association, and among altogether 500,000 people applicants, and each university has a good group. And then they know real cadaver. They know dissect the real cadaver is fundamental, essential, because we know each person has different structure and different. Okay, if you observe precisely, yeah, that's why still we know. So, yeah, medical dental students and medical dental doctors, we know anatomy and physiology is so important. I think maybe in Indonesia, maybe little by little, from the start, from the Andalas University. Yeah. Yeah. Ask Professor Nira Kasma and then Dean of the, uh, medical faculty and the president of the Andalas University. Yeah. Back in 1957 or 56, such kind of donation system has been started in Japan. And almost 60 years ago, and they have lots of problems because of shortage of cadavers. Like you have now, like you have the same problem, similar problems. Now and then you're using anatomy. Not bad. Not bad.
So you visit our lab anatomy, yeah, and you can see the condition, yeah.
Yes.
Yeah.
But much better to see, observe, dissect the cadaver by yourself. Hands-on clinic, hands-on seminar. Yeah.
Yeah. So, Prof, I saw some of your publication, your recent publication. One of them is I'm pretty interested with this one. So the title is this section still necessary? So yeah, it's your publication,
Yes,
but I think it's in the Japanese language. Yeah. So I couldn't get the English version of it. So maybe you can tell us a bit about your publication about this one. Is this section still necessary in this era? You know, with the digital-based era, is it still necessary for the dissection to be done? Yeah. Maybe you can explain a bit.
Yeah.
Thank you.
And is dissection still necessary? Okay. It's at the beginning, back in 1982. Soon after my graduation from the university, I could become the general GP, or I could become to maybe department of maxillofacial surgeon. And then at the time, my colleagues or my friend told me, okay, gross anatomy dissection is over. Everybody knows. Okay, such and such. Okay, masseter and temporalis, and everyone knows the knowledge of anatomy. Don't need to find, don't need to study, don't need to study anatomy anymore because too old. However, after 5 years, I couldn't find the answer. After 10 years, but after, I joined the one seminar. Totally 30 times seminar. And my supervisor, his name is Katsuji Kumaki. And he taught us, anatomy is not memorized subject. If you think the morphology, and if you think morphogenesis, why we have kind of shape? Why as I told you, why we have such kind of difference between Caucasian and Mongolian, and between maybe Caucasian and Negroid? Why? But nobody knows the answer. But some of them, they try to find the answer. It's kind of science. It's not memorization. And if you find anatomy is not memorization, it's okay. Oh, interesting topic. Okay. We can continue to study of anatomy. And I decided to be anatomist forever. I can I can choose my career as a general practitioner, GP. But okay, I'm very happy to be anatomist so far. Yeah, that's why. Okay, is dissection still necessary? Yes, it is. The answer. Thank you.
Okay, so you mean like the digital base at current
Yeah,
it
digital
cannot
base is
cannot replace the dissection itself.
exactly. But digital base is I don't criticize. But digital base is also good. But supplementary is maybe after you've learned authentic anatomy, and after that you have a digital base, so knowledge is totally fine. But for the beginning, from the beginning, digital base, oh, prosthetic model. Maybe have you ever heard it? In the States, they changed back in 1990. Oh, gathering anatomy, gathering cadaver is so difficult. It costs a lot. Okay, let's use a plastic model. Let's use plastic model in some medical university in the States. But they gave up. They gave up. Yeah, because
We still refer back
plastic model.
plastic
Plastic
model.
model is all the human being the same, but all the human being have different structure. Okay, 5 fingers is same, but inside the 5 fingers, different. 2 eyes, same, but inside 2 eyes, it's different. But medical or dental experts should know such kind of tiny difference. Yeah, it's so critical, so important. Yeah, it's my opinion.
It's true. It's true, Prof. I totally agree with you. Yeah, yeah.
Yeah.
Is there any other questions? Okay, good. It's really interesting topic, so you need to engage with this session.
Yeah.
Yeah.
Thank you. Konnichiwa, Ikyo Sensei. 私はロザ・シルピアです。ヒストロジーの先生、パダンから来ました。
Very good
私
Japanese.
は少し日本語がわかります。
素晴らしい。
Okay, for the next step, I will talk in English. Sorry.
Yeah.
So it's very interesting lectures and insight from you to all of us here. Do you think, yeah, you have mentioned before that the collaboration lecture and practical in histology, anatomy, histology, and physiology will give good impact in achieve the better understanding about the basic science of medicine, right? So what about in your medical school or other medical school in Japan? Have it been applied or still in developing the system?
Yeah, you're right. Still processing. Now, okay, okay, thank you for your, okay, nice question. Okay, now, joint lecture, okay, and practical between anatomy and physiology is still processing, and okay, even our department, our university, we didn't join. Okay, sometimes it's trial, yeah, but it's gonna be interesting, yeah, in the future. But now at the moment, still we have okay, all medical dental schools in Japan. We have a Department of Anatomy, Department of Physiology, they separate, and then yeah, that's why I think it's a good point. Maybe start from here. Yeah. Please join. Why don't you join anatomy and physiology and maybe joint lecture for the students, medical and dental students. It's gonna be very exciting. Yeah, I guess. Yeah, but we haven't started. We are progressing now. Maybe in 10 years, maybe I will tell you the result, which is good, which is not good. Thank you.
Okay, thank
Yeah.
you, Sensei.
Any more questions? Yeah. Oh, this is our professor from anatomy, Prof.
Thank you.
This is
Thank you very much.
yeah.
Terima kasih.
I'm Yanwirasti from Anatomy Department, University Andalas. I agree with you
Thank you.
that we must join anatomy and physiology because they all items anatomy nothing without physiology, but physiology there is no physiology without anatomy.
Yeah.
Yeah.
Same opinion.
That's right, yeah. Yeah, I agree about it. But in my university, my faculty, we have learned by only the separate department. Jadi separate time dan ini, and it is good for us that you have adjust us to learn by join it. But I think not just only anatomy and physiology, maybe and clinical too. And in clinical
Totally
too.
agree with you.
Yeah,
Yes.
because it will understand the student what is the meaningful of learning anatomy and physiology.
And
Not
clinical.
like me, learn before we learn the smaller thing that it not good, it not nothing for the clinical. I agree with you. And
Thank you.
maybe my
I agree with your opinion too.
and I hope my faculty there is no first did one, yeah, first did one will do it. Thank you very much.
Thank you too. Yeah.
She's one of professor in our department.
Yeah.
Yeah. And she taught us about anatomy for years and years. Yeah. Yeah.
I totally agree with you.
Yeah.
And then thank you very much. And I'm very happy to be here, invited from Professor Mira Kasma. And then, okay, such kind of some of professors, so now in the future, they're going to go, or they have been to Japan for 2 or 3 or 5 years or more than that. And such kind of exchange is so important. Yeah. And then exchange, not only exchange knowledge, but also exchange methods. Yeah. Also important. The international student, among students also. And maybe a lot of students want to go to Japan, and a lot of students want to come to Indonesia. Yeah. From now, we have to stick together and to share our knowledge. Yeah. In medical dental fields, not only medical dental fields, but also other fields as well. It's my opinion.
Okay, Prof, I just want to continue because Professor Yanwirasti touching a little bit about clinical things. Yeah, so I just want to pose question. Do you think it's still necessary? I mean, the dissection itself just necessary for first year medical student, or is it also important for first year residency program?
Yeah.
Yeah, I mean, how about in Japan? Is it also for the first year of residency program, they also do dissection, or how?
Oh, no, at the moment. Okay, it's depend on university, but basically after the graduation and with the postgraduate students, if they wish, they can. If they wish, but we don't have such not like medical attendant students.
So it's not in the curriculum itself, yeah?
Exactly.
Okay.
Exactly. Yeah. Yes.
Any more questions? No? Is it done?
Well,
No more question. Okay, if there is no more question, I have question then for you. Yeah, because I saw your publication majority discussing about variation itself, right? The variation of the anatomical structure. I mean, most of your publication talking about that.
Yes.
So I'm just wondering why you so interesting to study about the variation itself. And yeah, I mean, what is the impact for maybe for surgical procedure or for patient safety, and how far your research been applied or as a guidance for practical in the practice?
Yeah.
Yeah, I mean, can you elaborate that, please?
Thank you for your question. Okay, when I was a student, so I didn't know that such kind of variation exists in human being. But yeah, as one of my colleagues or many colleagues told me, okay, anatomy, human being is the same. But once I find it, first of all, I couldn't find a difference. I couldn't find anomaly. I couldn't find anything. Yeah, because too amateur. I think we need so for gross anatomy we need skill. Yeah, and then year by year, and we attend the seminar. Was held in Niigata University and so on. So I attended more than 50 times. Yeah, and then if you find it okay, anomaly, variation, and okay, just cadavers, but dead body told many things, and I'm happy to know that. And as I so let's you see the Adachi Buntaro Adachi. So I didn't meet him. I didn't meet him because when I was a university student, he passed away. Maybe he passed away long time ago. The Adachi's anatomical wall is still shining, brilliant. Still, many people, Adachi is concentrate on researching of lots of vessels and arteries and veins and lymph vessels of Japanese cadavers, using Japanese cadavers. And the Adachi wrote brilliant books, and okay, 5, 6 books. And still, such kind of researchers, they use Adachi, Buntaro Adachi's, yeah, Buntaro Adachi's study. Yeah. Therefore, yeah, for me, it's also happy to study of anatomy, and then study is not so, oh, okay. Study looks like very conventional, very old style, but yeah, if you find a new, new theory, it's kind of yeah, maybe happiness. Yeah, I think it's so. That's why. So I chose anatomy. Yeah.
Okay, thank you, Prof.
Thank you.
Is there any other question? Otherwise, I wrap up this discussion section. No? Oh, okay. From our Vice Dean, Prof.
Yeah, thank you very much, Dr. Dewi. Professor, I would like to ask you about the research by the variation of anatomical lateral artery. I would like to know whether is there any effect, for example, in Japanese 90% the style is lateral, but another type is medial. So is there any effect or influence to that people maybe? And the next question is, what about other research or only in Japanese and European? What about for Southeast Asia research? Is there any research to find another variation of lateral artery in maxillary anatomy?
yeah.
Maybe that's
Okay.
all.
Thank you for interesting question. Thank you very much. Yeah, indeed. Okay, as you know, such kind of variation, such kind of anatomy anomalies is not disease, disorders. If you have a medical type, lateral type, nothing, okay, you don't have any disease. But okay, for the from the medical point of view, for the surgeons, maxillofacial surgeon and the ENT surgeon is so important knowledge for them to know. Yeah. And then, of course, today I'll show you the variation of maxillary artery. We all have a variation, and especially artery is so important, and veins second, and nerve also, and also we have a muscle variation, but they don't care because it's not disease, it's not disorders. But why we have such kind of variation, nobody knows. And we call the sternal muscle here, but usually we don't have it. Only 7.7% in Japanese. We have sternal muscles. And then, I don't know, but percentage is much higher in Caucasians. But Caucasians, in German, maybe in France, I don't know. But okay, such kind of anomaly, such kind of variations, and then so for clinicians, they don't care. Of course, it's not disease, but okay, it's gonna be interesting. Yeah, it's kind of science. Yeah, and in the future, maybe why they have sternal muscles, why they have a lateral type, why they have medial type, using another method, maybe IPS or molecular biology or DNA, I don't know. But yeah, it's such kind of variations still exist in human being. Yeah. And maybe so I dissected cadaver over 4,000. And then okay, I love human being. Yeah, but still, yes, I'm still so deeply, I'm loving human being. Yes. Yeah.
Okay.
Yeah.
Any
Yeah.
more question? Okay.
From the
No, I mean,
doctors,
you can give
younger
the
doctors.
speakers. Please introduce yourself.
Thank you for the opportunities. First, thank you, Professor, for the very amazing presentation. And my name is Tifa Pramavi Aisyah, as a first-year biomedical science student from the Andalas University. So, I have a question. So in biomedical science in medical university in Andalas, so we also learn about the anatomical, physiological, and the histology from the human body. So, but I still have a question on my mind. How deep I need to learn about the anatomy and physiology as a biomedical science, or some of the university in Japan who also have the biomedical science major and learn about the anatomy, physiology, and the histology. So, what is the impact how deep we need to learn as a biomedical science student? So maybe that's all from me. Thank you, Professor.
Your question is how to learn biology and how to learn anatomy, histology, physiology efficiently.
Yes.
How deep?
How deep we need to learn? How deep? How deep I need to understand about the anatomy and what is the efficient way to learn about this?
Yeah.
Thank you
Yeah.
for
The-
your very okay.
This student is coming from biomedical student.
Biomedical.
Biomedis.
Ah.
Yeah. Biomedical student. So it's not from medical student, but biomedical student.
Oh.
Yeah. They also learn anatomy. So they want to know how deep I should learn anatomy for biomedical student. That's their question.
Wow.
Yeah.
Okay, thank you for your brilliant, nice question. Yeah, I think it's from now we have to, yeah, we have to stick together. Not only medicine, medical part, but also biological part, and then biomechanical parts, and then yeah, any other parts. Yeah, for okay, to achieve such kind of cooperation, open, open, open the knowledge to the maybe I strongly recommend you to organize seminar, and then I organize seminar by myself altogether 20 times, and one seminar it required 2 weeks, and then so welcome student from doctors, medical doctors and dentists, and also biomechanical scientists, and also OTPT students, or occupational therapists and physiotherapists. And then we let them draw, we let them dissect cadavers, and then draw pictures. And then finally, the in between and the final day of the seminar, 2-week seminar, and we ask them to give or share or deliver their presentation. In the presentation, they exchange their knowledge. Yeah, it's one of the best, good way, not best, but good way to obtain such kind of knowledge in the future. Yeah, I think that's good question. From now, it's best. It's very important. Important. The back in 1950 or back in 1850, so medical, so parts, only they think about medical, and dental parts only think about the dental. The biomedical part only think of biomechanical. But now, why don't you stick together, cooperate each other? Yeah, I think it's now time to cooperate, time to stick together. Yeah. Thank you. I think I totally agree with you. Yeah. Let's have a seminar.
Any more question? Otherwise, I have maybe okay. We still have question. Okay.
Okay, thank you, Professor, for your lecture today. Before that, let me introduce myself. My name is Regina Putebari, as a first-year student of medical science. I have one question, Prof. How can we shift the mindset of learning anatomy from memorizing to thinking? And what is the best strategy for us as a student? Thank you, Professor.
Okay.
Yeah.
I can
The best strategy to study effectively for anatomy for biomedical student. Yeah.
Wow, that's a good question. Yeah. Wow.
Found it's really, really difficult for them to study anatomy. So that's why they want to know, is there any tips or trick how to study effectively for anatomy?
Oh, that's good. Wow. Oh, it's so difficult. Yeah. Yeah. It is. So do you have any chance to attend seminar or some, I don't know, but Wow, that's good question. Yeah, yeah, it's important. Yeah, only reading book not good. Yeah, attending seminar. As you know, running a pyramid, and running pyramid is. So I didn't bring it, but maybe yeah. First of all, lecture. Lecture. If you attend the lecture, only 5%. Yeah. And then maybe I forgot the second, third, and the fourth. But okay, in the middle is okay discussion. It's much better to
retain the information. Yeah.
And then the fifth or sixth is attend okay dissection course or such kind of course, practical course, and to make something by yourself. And final one, basically, is good, best method to get the knowledge is to teach. So anybody, your knowledge. And please imagine, okay, if you have an opportunity to teach or to give a lecture, you have to prepare. How many hours? I don't know, but I don't know. So okay, your specialty. But if you want to teach one title, but you have to for preparation of your presentation, you have to lead, you have to train, you have to prepare, and then so lots of knowledge into your mind. Teaching is the best way. Yeah. But okay. I don't never say, attending lecture is bad. Never say. I think lecture is but only hearing, listening. Yeah. But if you teach something, you have to. So you have to repeat again. You have to learn again. Yeah. Teaching or attending seminar and practicals is something it's good. Yeah. Not passive learning, active learning. Active learning is the best way to learn anatomy and physiology.
Yeah. So you could do combination.
Yeah, combination is very important. Thank you.
Because every person has their own way for learn.
Exactly.
Yes. So I mean, you yourself know which one is better. You could do combination from all different methods, so that you can learn effectively for the anatomy. Okay, I think it's the time's up for the discussion session. I would like to thank you to our speaker. Just please give a big applause for Prof. Ikuo Kageyama, for such an insightful discussion on anatomical structure and variation in conjunction with the new paradigm in anatomical education. So I would like to highlight a few key take-home message from today's conversation. First, anatomical variation is not a rare exception. It's a fundamental aspect of human diversity. So understanding this helps bridge the gap between textbook anatomy and real-world clinical practice. So second, appreciating variation is crucial for safe and effective healthcare, especially in fields like surgery, radiology, and anatomy-based diagnostic. What may seem like a minor deviation can have a major clinical implication. So the third, we heard how current teaching methods are beginning to shift, moving beyond the one size fits for all anatomical model. This aligned directly with the new paradigm in anatomical education, which emphasized personalized, technology-driven, and clinically integrated learning. The fourth, tools like digital-based, like 3D imaging, virtual dissection, and patient-specific model are not just futuristic, they're already shaping how we teach and learn anatomy today. So this innovation allows us to visualize variation more accurately and inclusively. Finally, the discussion reminded us that the anatomy education must evolve that not just in content, but in mindset. Teaching students to expect variation, not to be surprised by it, but it's key to preparing them for real passions, not idealized models. Just as what we've seen in the digital, maybe it's like something fixed, so we couldn't identify the variation that is present in each human body. So in essence, embracing anatomical variation is not just a detail, it's a doorway into a more adaptive, realistic, and human-centered anatomical education. And that's at the heart of the new paradigm we are all striving forward. Thank you again to our speakers. And now I hand it back to our MC, Fajar. Thank you very much.
Okay, thank you, Professor and Dr. Dewi. Let's give applause to Professor Kageyama and Dr. Dewi. All right, ladies and gentlemen, next we will present a certificate and souvenir to Professor Iku Kageyama. This will be given by Vice Dean to Professor Dr. Rosa Sokmarita, PhD. Please welcome. All right, we also present a certificate to moderator to Dr. Dewi. This will be given by Dr. Citra Manila SP as Manager of Academic Research and Public Service. Please welcome to Dr. Dewi and Dr. Citra. Okay, and we also present a certificate to moderator to Dr. Dewi. This will be given by Dr. Citra Manila SPF as Manager, Academic Research and Public Service of Fakultas Medicine, Universitas Andalas. Okay, ladies and gentlemen, finally, this is the end of our general lecture today. And we say thank you again to Professor Iku Kageyama for the interesting lecture. And for the all committee member and all audience, we say thank you very much for being here from the beginning until this last seasons. And I am Fajar Irianto as Master of Ceremony. Say thank you for your attention and mohon maaf lahir batin jika terdapat kesalahan dalam penyampaian. Saya tutup dengan wabillahi taufik walhidayah. Wassalamualaikum warahmatullahi wabarakatuh. Oke, tentunya kami informasikan juga kepada seluruh peserta yang hadir di ruangan Untuk dapat mengisi presensi untuk sertifikat nantinya pada kuliah umum kita pada hari ini itu bisa diakses di meja registrasi atau mungkin nanti akan ditampilkan di layar videotron untuk presensi absennya. Kami ingatkan sekali lagi kepada seluruh peserta, jangan lupa untuk mengisi link absensi presensi untuk kuliah umum kita pada siang hari ini untuk mendapatkan e-sertifikat nantinya. Terima kasih.